Do I have your permission to use this video in my online class, Corrective Techniques of Movement Dysfunction?
Yes.
First thing we're going to do with him is we're going to assess his scapular motion. We can do this in one of two ways. The first is I can get his shirt off and I could use the kibble lateral slide test, which I do really like to use to assess the distance between, in centimeters, between his spine and inferior border of his scapula in 3 different positions. And this can tell us if there's any kind of lateral tilting to the scapula normally. How I'm going to do it with him in the interest of time is we're just going to check for general motion of the scapula, scapular mobility, which I know that he already has from working with him, but I'll demonstrate here. We're going to horizontally, or just regular abduction, slow all the way up. And we can use our hands as kind of a guideline, especially since he has a shirt on. I can feel the scapula and rotate with it again one more time. He's a right-handed thrower, and he actually does have a little bit more mobility on the right side. So in order to produce good motions in the pull technique, we're going to need to have good scapular mobility and scapulothoracic rhythm, which he does seem to have. Now, in order to train in the pulling and train the scapular muscles, the thing I really like to focus on is lower trap activation, rhomboid activation. So the first thing we're going to do is I'm going to bring him over here and get him, let's have you seated on the ball, and we're going to use a TheraBand. Now we're going to use red for him for today. You can progress obviously in thickness of TheraBand, sets and reps, etc. The Swiss ball is going to make sure that he's activating his core correctly, and as we saw last week, we're going to want to assess his core activation, TA multifidus activation, and that's going to be important here in a second. Let's go robbery, drive the elbows back to the back pockets. Good, and you can see we're driving the elbows back. We're looking for lower trap activation here. We can actually palpate lower trap rhomboids to make sure we're getting good scapulothoracic pinch and activation of the scapular muscles. This shouldn't really be an arm exercise. You should feel this more through his back, which is very important, especially in our throwing athletes. We can go from here and progress this to make it more difficult, further activating the core in an upright position, not too much, a neutral spine, not too much extension, lifting the leg. And you can see this leg is lifted up here, the left side. Go ahead and go again. And this forces him to activate the core. Now this is a more dynamic position, especially when we look at our throwing athletes. Very good. We're looking for good control. He's not pulling back into extension here. We're maintaining good neutral pelvic tilt. We're going to switch sides. Good. Usually I do 5 to 10 reps on each side before having them switch sides. We can also progress into a sustained hold on this if we wanted to. Now once he's done with this, let's have you go on your stomach for me. We're going to put him in prone on the Swiss ball, and the next phase from this, I find this is a little bit more difficult than the seated because it's going to make him activate his multifidus. Now we can use either dumbbells or a TheraBand to further increase weight on this activity. We're going to do robbery and prone, drive the elbows back to the back pockets. Good. Now you can see that he's having a little bit of difficulty maintaining proper core stability here and spinal stability. We want to maintain a neutral alignment there. And we can use some feedback from our own hands in palpating to make sure we're getting good lower trap activation in our throwers. We're maintaining a neutral pelvic alignment in order to make sure that he's doing this correctly. Good. And stand up for him. Now also in our throwers, we want to make sure that we have a good pulling motion, especially in our hitters, golfers, baseball players, softball players. We want to make sure that we have good rotational dynamic stability. So the first thing we're going to do is we're going to have him do a double leg bodyweight squat. We need 3 reps. And we're looking at pelvic stability here. We're looking at feet position. He's good shoulder width apart. Feet are pointed straight ahead. We're getting knees over feet, which tells me that he has pretty good double leg stability. Now let's go ahead and go to single leg stance, right side. Looking for any Trendelenburg posture, any kind of dropping down at the knee and the valgus. I'm going to switch. A little bit of tilt to the left side, really pretty good here. Go ahead and let's go single leg squat from there. Good. We're looking at pelvic tilt, a little bit of trouble stability-wise, again, but he does stay over his toe pretty well with the knee. Go ahead, switch. Again, I'm looking for pelvic tilt. A little bit of flexion indicating some kind of, maybe some functional instability at the core. One more time. Knee staying over the toe. Pretty good stability-wise there. Now, with any of that kind of tilting one way or the other, we're going to correct that by doing a half kneel rotational chop and lift technique. Go ahead and on your left knee, please. As his left knee was the only one that was marginally off, we're going to have him, he's going to pull down with this side, pulling towards across the body diagonally, good, into the open space. And this is going to tell us a little bit more about any kind of instability at the core. We can see he is tilting a little bit, so we want to make sure he's in a good position here. And this is the first step in the correctional progression, is to make sure he's maintaining good core stability. This takes the legs out of things, out of everything, and allows us to not have the legs doing any kind of corrective activity, and it allows us a core rotational motion. We can take this and we can put him on a foam pad, such as an Eric's pad, on one knee. To add, once he's there, add a little bit more instability. Good. And sometimes we may actually have to give a little bit of a lift. He's tall enough with how we have this set up. This can also be used in a cable crossover machine type of a situation. And to demonstrate the difference, go ahead and flip around for me. Demonstrate the difference. We can see he is much more straight up and down, rotating away from or towards the right side from the left side, indicating he has a lot more stability here on this right leg. Some of that could be he's a little bit more right leg dominant. He's a right-handed thrower, which makes it interesting to note that he's also a right-handed hitter, and you would have to rotate towards the left side for that stability. So this is an exercise that may actually really benefit him. And again, we can add the stability underneath. Go ahead and stand up. Once we've allowed him to get to some pelvic stability and core stability in this rotational lift and chop, kind of a pulling motion, we can get him back to a neutral stance. Good. And I'd start him at a neutral stance here, as it's a little bit less intensive. We're going to go ahead and lift this up a little bit. Good. And we're going to the same kind of activity trip, pull across. Good. And we can see in double leg, he's not compensating at all. Now what we can do from this position is bring this one forward, drop back, scissor stance, good. Point the toe towards me. And we can see his toe is actually pointed out a little bit here, and we want to make sure we're in a neutral position. Again, that's that compensation from the lower extremity that we'd be trying to correct. Spin around and go the other way, other foot in front. Good. A little bit higher, start a little higher. There, good position, good. And from this position, with the left side back, again, we noted that he had that instability on the left side. We're opening it up. We can see he's a little bit more pulling towards the left side, which is the side he would swing to. Again, this is something that could really benefit him, getting that TA activation, multifidus activation. We want to correct his breathing prior to this and everything, but from a pulling technique standpoint, this is something that could be very beneficial for him. This is also an activity we could progress him in a sense of, from a chop standpoint, from a standing, we could also go a pad on one side. Let's go ahead and do pad. And we could actually do a double pad, or we could put him on a Bosu ball. Now if we're going to go staggered stance, another thing I like to do, this adds that unstable surface. Rotation. We can see he's a little bit more hesitant to do this. His rotation is not quite as secure as he's trying to stabilize himself from the lower half. We could progress onto a Bosu ball, something a little bit more unstable from that standpoint as well.